This is Building Consensus for Electronic Health Records, Jacksonville University, Nursing 353, Spring 1, 2014. This is Group 2's project. Members include Jessica Moore, Colleen Placente, Amanda Rogers, Lisa Stevenson, and I'm Mark Stepp, and I'll be narrating as we explore how to undertake this project. What is consensus? According to Merriam-Webster, consensus is a general agreement about something, an idea, or an opinion that is shared by all the people in a group. The purpose of this presentation is to provide an overview of methods to obtain consensus or support for the electronic health records, along with advantages of implementation for specific healthcare disciplines. An electronic health record, or EHR, is a computerized medical record created by or created for an organization that provides patient care, including hospitals and physician offices. The EHR is not to be confused with the EMR, the electronic medical record, which is a digital version of a paper chart that contains all of a patient's medical history from one practice or facility. How do we obtain buy-in from our stakeholders, which is going to be absolutely critical to moving forward with the project? First, we need to convey the urgent need for change. Making a major change in a clinical environment is difficult in itself, but trying to implement change when people don't recognize the need for change is a recipe for failure. Stakeholders need to understand that new technology is essential and how it can impact in other ways besides charting. For example, it can impact financial viability, quality reporting, and even staffing. Logic versus emotion. You may present a great logical case for adoption of an EMR in your facility. However, most people don't think with logic alone. Emotions play a big factor in this. So you have to appeal to the emotional side to get their buy-in as well. They have to understand what the consequences are if the implementation isn't successful. Also, in light of today's economic realities, it's important to recognize and communicate that when work gets reorganized by the use of the EHR, staff members can often assume more valuable and more productive roles in the organization. We also need to harness the power of collaboration. To get maximum support, we need enthusiastic collaboration from every stakeholder. This includes clinical and non-clinical staff members in planning this technology implementation, and also in developing strategies for realizing maximum benefits from the electronic health record all across the board. Psychological ownership. When the staff's involved with the planning and the implementation, they seem to take more of a personal interest and ownership of the project. And in turn, they'll be more committed to the success of the project and try to assist by pointing out any potential problems before they become major issues with the system. What's in it for them, the stakeholder? Do your best to try to build excitement and interest. And to do that, the first thing we have to deal with is anxiety. Everyone is anxious about the future because the present is so much more specific and we have a good understanding of what's going on now, but again, uncertainty about the future. The best way to gain buy-in is to give them a good vision of the future. Let them know what it's going to look like, not just bullets and slides in a PowerPoint. Nor should it just be numbers and check boxes. You also have to look at the old cliche, what's in it for me? The challenge is that everyone is wired a little bit differently, and we need to know exactly what the various strengths are of the team and ourselves in order to make this happen. If you can approach this from an individual basis, then collectively you'll get better buy-in. What is meaningful use? It's a set of standards defined by the Centers for Medicare and Medicaid Services incentive program, which regulates the use of electronic health records and offers providers and hospitals that are eligible to receive incentive payments when certain criteria are met. As of December 2013, CMS has paid out more than $19 billion in incentives to eligible hospitals and healthcare providers that are enrolled in the Meaningful Use program. The following slides are going to demonstrate the potential benefits of compliance with Meaningful Use. As you can see through this chart, the earlier that you implement, the more refund or benefit that you'll get in return. Hospitals adopting the basic EMR has more than tripled since 2009, as you can see reflected in the chart, from 12 to 44%. The percent of hospitals possessing a certified EHR technology increased by 18% between 2011 and 2012, and that was an increase from 72 to 85%. Benefits of Meaningful Use: improve quality, safety, efficiency, and reduce health disparities. You can also engage your patients and family, improve care coordination and population and public health, maintain privacy, security of the patient health information. Compliance is going to result in better clinical outcomes, improve population health outcomes, increase transparency and efficiency. It will empower individuals, and it will also allow for a more robust research data on health systems. Some of the advantages for medical professionals to use an EMR: visits can be upcoded, which will allow for bigger charges to the insurance companies to compensate for that additional time that entering the data up front on each patient required. Monetary bonuses, as we've already looked at. If you convert early, $44,000 for eligible professionals in the Medicare EHR program, and up to $63,000 for eligible professionals in the Medicaid programs. It will also provide accurate, up-to-date information about patients at the point of care, and it will also securely share the electronic information with the patient and other clinicians for patient and professional communications. Also will allow for safer and more reliable prescribing. It also improves efficiency, enables the facility or the office to be able to recruit and retain talented young clinicians. Patient information is available instantaneously: labs, radiology, test results, immunizations, allergies, the patient's history, their diagnoses, and medications. It automates and streamlines the workflow. It will also increase the accuracy of patient information. For medical record staff, records and notes are going to be much more legible, which will lead to fewer mistakes during transcription or ordering of medication. Greater privacy and security of the data itself. More physical space with the elimination of physical paper records. Improved emergency backup and recovery. Less time chasing charts. Other advantages for medical records: the staff can more efficiently locate and process patient information, better information availability, improved medical practice management with scheduling, coding, and claims, reduced paperwork with forms and billing, enhanced information sharing with automated delivery to and from the lab, other tests, referrals, prescriptions sent to the pharmacy, and orders sent to radiology. For billing and administrative staff, need to introduce them to practice management systems, or PMS. Practice management is all about billing. The potential for maximizing collections and payment options is key to the health center's widespread investments in the system. It will also improve health centers' abilities to bill, and it will also streamline general day-to-day management operations. Increases the organization of billing data, catch wrong and missing data elements from the encounter records. It will manage patient scheduling and check-in, facilitate eligibility determination, and coordinate the electronic submission of claims. Health centers' reporting requirements, such as the Uniform Data System, are also an important reason for using PMS. This system will also allow access to pre-designated reports, which are meant to satisfy those UDS reporting requirements to the feds and to the state. Scheduling functionalities were widely reported to be of good quality and extremely valuable to the health centers. The system allows for double and triple bookings to accommodate transient patient populations, and health centers are pretty happy to have the ability to schedule patients with specific examination rooms and specific providers. Billing and accounting. Health centers have indicated that their billing systems and accounting modules are a significant improvement over systems used in the past. Claims are typically generated, sent, and reimbursed far more quickly with sophisticated practice management systems. Most applications pre-screen claims before they're sent out in order to catch any coding errors. Most also express high satisfaction with the billing functionalities. The return on investment from billing improvements is quite considerable. Security of the system is going to be designed by the system's vendor, and it'll help streamline compliance with HIPAA, electronic data interchange regulations. And this HIPAA compliance is ensured by the vendor when the product is built. Electronic claim submissions. It does support electronic claim submission capabilities. The system's success at making accounts receivable and cash flow more predictable, as well as about built-in logic to detect any coding errors. And reporting. Reporting capabilities are a key aspect of the system, and enables healthcare facilities to generate a wide variety of reports from basic to very complex reporting and spreadsheets. For clinical managers, internal performance improvement, or PI reporting. It facilitates quality improvement discussions during clinical meetings with the data being more readily available. You can track certain patient PI initiatives, such as catheter-induced urinary tract infections, central line infection rates, and patient fall reporting. External performance improvement reporting. Various state and federal quality improvement initiatives, including the Hospital Quality Incentive Demonstration and the Centers for Medicare and Medicaid Services. We'll look at our measurable quality outcomes and readmission and rates, including things such as heart failure, acute MI, pneumonia, coronary bypasses, and hip and knee replacements. We can also look at patient satisfaction, basing it on the hospital consumer assessment of healthcare providers and systems. We can cover discharge information, medication information. We'll also have improved physician-to-patient communications. There's also some self-monitoring tools for the patients, which would include health risk assessments, educational resources, and appointment reminders. Improve workflow and processes. It can help with staffing, eliminate duplication, will give you consistent data sets or standardization. It will enhance coordination and integration of services, and also improve organizational efficiency overall. Resource accessibility. Internally, policies and procedures, clinical guidelines, evidence-based protocols are right at the fingertips of the provider. External resources, National Institute of Health, National Library of Medicine, and many other online databases and websites. Nursing in the EHR. Our text tells us that nursing informatics is a necessity, not a luxury. And in today's rapidly changing health delivery system, all nurses need to have basic informatics skills. The Technology Informatics Guiding Education and Reform, TIGER initiative, emerged with the purpose to create a vision for the future of nursing to provide safe, higher quality patient care through the use of IT, and it calls for the redesign of nursing education to keep up with the rapid changes in technology. As projections of a global nursing shortage become more and more visible due to an aging population, and studies have shown a relationship between the number of patients assigned to a nurse and clinical outcomes, care delivery models must be redesigned to meet this need. Technology itself cannot solve problems that result from staff shortages, but it can certainly help prevent errors by giving busy nurses a system of double checks. The nurse will enjoy more time to provide patient care since documentation will be less time consuming when using a computerized system. Each unit can have work areas set up at nursing stations, but could also be provided with computers on wheels, or cows, or tablet-type devices that can be brought into patient rooms, or even computer terminals in each room to allow for real-time documentation. In summary, let's be excited about the future. Let's keep up with advances in technology. Let's all be able to say, I assisted in the creation of the EHR in my healthcare system. Medical records. Isn't it going to be nice to not have to go to chart chasing, to have all patient records at your fingertips, and to not have your office space overrun by charts? Forget trying to decipher physicians' handwriting. Notes will be legible and with less risk of improper interpretation. Billing. You will enjoy increased organization with the result being proper billing for services and electronic claim submission, making accounts receivable and cash flow more predictable. Schedulers. Imagine the ease of scheduling a patient at a specific time to a specific exam room with their preferred provider, all with a few simple keyboard strokes. Nurses. Embrace your major role as the key player in this transition. Your input will help individualize your facility's EHR. Offer suggestions for system design and requirements that suit nursing needs, which in turn will result in more organization and efficiency of the hands-on patient care that you're now going to have more time to provide. Understanding that you're still expected to provide excellent and safe patient care during this transition and beyond. Clinical managers. Imagine how beneficial it's going to be to be able to track performance both internally and externally, to know exactly what is working and what's not, and to be able to make changes in a more timely fashion. You will have the ability to analyze and compare patient satisfaction scores to healthcare systems across the country. The EHR does increase your staff's resources by having policies and procedures at their fingertips. Senior leadership. Please don't keep these benefits from your healthcare system, your employees, or your patients. Avoid penalties. Make this transition before 2015. Throughout this presentation, we have provided an overview of methods to obtain consensus or support for the electronic health record, along with the advantages of implementation for specific healthcare disciplines. It's our hope that this material will be useful in assisting a facility to realize the value of converting to an electronic health record system. And finally, thank you for viewing our presentation on building consensus for the healthcare record.